Hello, Uta here with the last of this one, Orchid. I'm gonna let it be in the screen. I think I bought it around September 17th of last year, which is, of course, the anniversary of my mother's death in 2019 at age 100. I am going to just read out now the words of a doctor, a psychiatrist, okay, who is disenchanted with what is known as the gender affirming model. Now, thank you to Eliza Mondegreen of her Substack blog, Gender Hacked. She posted this, and I think it's very telling that this psychiatrist cannot publish his own papers. He cannot use his name. He's just anonymously going to Reddit so that he can say his observations. Here we go. The title is, in quotes, his words, "I suspect but cannot yet prove that the gender-affirming model is actively harmful." This Reddit post on r/medicine, written by a disenchanted psychiatrist, is worth reading in its entirety. But there are a few passages, Eliza says, I'd like to pull out and discuss. First up, useful insight on why some medical professionals who mostly know better go along, even as adverse outcomes pile up. Okay, so this is the doctor's words now. He or she says, "Therefore, for most of my career, I have been in the odd position of doubting my gender-affirming colleagues who would say trans kids know who they are and talk about saving lives from suicide, but also believing that they were making the best of a difficult situation. In the absence of any hard outcome data, all we had to argue about was theory and priors. I routinely saw adverse outcomes from these treatments, both people who regretted transitioning and those whose dysphoria and depression kept getting worse the more they altered their bodies. But I had to admit this might be selection bias, as presumably the success cases didn't go on to see other psychiatrists." My Uta's note here is that it is such a large number who are unhappy and remain seriously psychiatrically ill that this cannot be ignored. I could be privately skeptical, but without any hard data, there was no public argument to make. The gender-affirming clinicians claimed that they could correctly identify which kinds of gender dysphoria required aggressive treatment, and even when they were wrong, they were appropriately trading a risk of long-term morbidity for short-term mortality. And this is the same with the adults. It's always, but their lives will be shortened by drugs, alcohol, or suicide if we don't do this for them right now. The author then proceeds to take apart a 2023 article claiming to find improvements in psychosocial functioning among gender dysphoric youth after 2 years of cross-sex hormones. The problem with Chen 2023 isn't its methodological limitations. The problem is its methodological strength. Properly interpreted, it is a negative study of outcomes for youth gender medicine, and its methodology is reasonably strong for this purpose. Despite the author's conclusions, an in-depth look at the data they collected reveals this as a failed trial. The authors gave 315 teenagers cross-sex hormones with lifelong implications for reproductive and sexual health, and by their own outcome measures, there was no evidence of meaningful clinical benefit. The author goes through the study in some detail. These are Eliza's words now, and then lingers on the minimal improvements in mental health outcomes in quotes, positive effect, up 0.8 on a 100-point scale, so less than 1%. Life satisfaction up 2.23 points on a scale of 100. Minimal decreases in depression, minus 1.27, and anxiety, minus 1.46. So on a scale of 100, less than 2% improvement. These appear to be small effects, but interpreting quantitative results on mental health scales can be tricky. So I will not say that these results are necessarily too small to be clinically meaningful, but because there is no control group, these results are small enough to raise concerns about whether gender-affirming healthcare outperforms placebo. Placebo being thinking that you're doing something, the sugar pill, and you feel better anyway because you think that you're doing something and your brain is having positive thoughts. Okay. It is unfortunate that it is not always straightforward to compare depression treatments due to several scales being in common use, but we can see the power of the placebo effect in other clinical trials on depression. In the original clinical trials for a drug called Trintellix, a scale called MADRS was used for depression, which is scored out of 60 points, and most enrolled patients had an average depression score from 31 to 34. Placebo reduced this score by 10.8 to 14.5 points within 8 weeks. Interesting. Okay. The short-term effect of gender-affirming healthcare, so-called, is no longer an unanswered question. Its theoretical basis was strong in the absence of data, but like many strong theories, it has failed in the face of data. Now that 2 studies have failed to report meaningful benefit, we can no longer say, as we could as recently as 2021, that the short-term benefits are so strong that they outweigh the potential long-term risks inherent in permanent body modification. Some non-trivial number of patients come to regret these body modifications. So some number of patients, which is non-trivial, not 0.1%, come to regret these body modifications, and we can no longer claim in good faith that there are enormous short-term benefits that outweigh this risk. The gender-affirming clinicians had 2 bites at the same apple to find the benefit that they claimed would justify these dramatic interventions, and their failure to find it is much greater than I could have imagined 2 years ago. I am not unaware how fraught and politicized this topic has become, but the time has come to admit that we, even the moderates like me, were wrong. When a teenager is distressed by their gender or gendered traits, altering their body with hormones does not help their distress. And of course, he or she only feels able to say this anonymously on a platform called Reddit. I suspect, but cannot yet prove, that the gender-affirming model is actively harmful, and this is why these gender studies do not have the same methodological problem of large placebo effect size that plagues so much research in psychiatry. When I do in-depth chart reviews of suicidal 20-something trans adults on my inpatient unit, that means people who must have had a suicide attempt and had to be hospitalized, I often see a pattern of a teenager who was uncomfortable with their body, affirmed in the belief that they were born in the wrong body, and then in parentheses, which is an idea that, whether right or wrong, is much harder to cope with than merely accepting that you are a masculine woman or that you must learn to cope with disliking a specific aspect of your body. And their mental health gets worse and worse the more gender-affirming treatments they receive. I think it's really, really sad that he or she does not feel able to put their name to this. You know, this is someone who is treating suicidal young adults who are post hormones, and in some cases post-surgeries. And it didn't cure the whole thing. It is not magic. First, they are uncomfortably being traditionally feminine. Then they feel fake after a social transition and masculine haircut. Then they take testosterone and feel extremely depressed about being a man with breasts in quotes. Then they have their breasts removed and feel suicidal about not having a penis. And that so-called phalloplasty surgery is notorious for having failures, serious failures. The belief that there is something wrong with my body is a cognitive distortion that has been affirmed instead of Socratically questioned, meaning using logic, with cognitive behavioral therapy. The iatrogenic harm can be extreme. These are quotes from a doctor. This shows great insight into patients and sounds almost exactly like a section of my own thesis that explores possible examinations for why mental health members of online trans communities seem to deteriorate over time. I think these are Eliza's words now. Basically, it's terrible for your mental health to believe there is something fundamentally wrong with you. This likely obtains even if there is something fundamentally wrong with you, the power of positive thinking and whatnot, but especially in cases where a patient's struggles are fairly ordinary, this is an absolutely toxic idea to take on board. It cuts you off from your body. In other words, it increases the body dissociation. Your real-life friends and your family, that's a separation from all of them, and it binds you to a body modification cult. Online trans communities promise members that transition helps. And at every stage of transition, no matter how badly transition is going, the community promises that if you take the next step, just do it, trust us, you will feel better. And her last name is Kolner. There's a Swedish woman who did these things. And the whole idea was introduced to her when she was a young adult by a friend who had done this, and she just got worse and worse. I can't think of her first name at the moment. I think it starts Emela. I think it's Emela, Emele, Kolner. But many people seem to feel worse, and it's no wonder why. Participating in these communities, imbibing this belief system, you become sensitized to hundreds of new ways to feel uncomfortable in your own skin. You're told that ordinary problems of living, familiar to all humans across time and space, need not be accepted. They can be cured or sidestepped. As the gap between how you feel on the inside and how you appear to the rest of the world widens, every encounter with the world outside, the cult starts to chafe. Life itself becomes unbearable. Young people talk about feeling like imposters, fakers, and liars. This is because they are in fact imposters, even though the community rushes to reassure them that they are not, that it's not your fault if no one understands. And meanwhile, they tell you that, everyone is cheering you on. Deep in the comments section, the author writes, so this is the psychiatrist, I do not think we should do nothing for these patients. Only counsel them with cognitive behavior therapy the same way we do with anyone else who is unhappy with their body, and the same way that the trans community does when patients are at the end of the process or unable to proceed for other reasons. What should a therapist tell a man who ideates a female persona, that's my phrase instead of trans woman, with gender dysphoria, and the dysphoria is related to the inability to become pregnant, whereas what my ex-husband Nettie did was he just pretended that he was the one who did that. Any answer to that question can be applied to other manifestations of gender dysphoria. In other words, the positive thinking of cognitive behavior therapy is probably the best approach. I also suggest acupressure chiropractic, Feldenkrais physical therapy, Uta Hagen's wellness movements playlist, a non-religious variety of yoga, and Alexander bodywork, as well as many, many strategies to calm down the vagus nerve, because that is the nerve going from the brain into the torso, and it is the one most involved with the PTSD and anxiety and depression type feelings. And I can tell you that, just a daily practice of doing this, not too hard pressure on your temples, tapping yourself on your head, doing the tapping on your chest, as well as some system of movement, can bring you back to your body. My last thought is that with my movement system, I've been really focusing on the outer periphery and thinking of it as the sphere of wellness. And I think of my arms and my fingertips and my toes and my top of my head sort of touching or just grazing this sphere of wellness that I picture around myself. And I think of it as being a delicate membrane, like that membrane on the inside of an eggshell. And I think of myself making that sphere stronger around myself, and that sphere getting stronger and imbuing me with spiritual and psychological strength. So please like, subscribe, and share, and be well in mind and body always.